In the last segment, we reviewed the 4 most common causes of back pain and their evidence-based treatments. If you missed that, go back and check it out. In this segment, we'll go on and go over what you need to do to make sure you never get in a position to have a botched spine surgery. If you haven't already, please subscribe to our channel. You often hear horror stories about back surgery, and there's a reason for that. Unlike the shoulder, knee, or even the hip, the lumbar spine is not one joint, it's 10. There are 2 facet joints, a disc, 2 nerve roots, and multiple ligaments at each level. To make matters worse, there are 5 different levels in the low back and a bonus one more if you count the sacroiliac joints. Each of these structures has a typical pattern of pain. If you understand the pain pattern, you can make a good guess as to the cause. As you might imagine, the complexity of the low back can lead to confusion, desperation, depression, and nothing good happens after that. I call this the death funnel because at the bottom, your life as you know it is functionally over, and often literally as well. Let me give you an example. I once saw a 55-year-old man who had worked his whole life to retire early and couldn't travel because of severe back pain. He felt like he had a knife in the back. The pain was made worse by sitting down. MRI showed moderate spinal stenosis at L4-5. After canceling a cruise he saved up for his entire life, the man found another spine surgeon who recommended an L4-5 laminectomy. But the man still had the exact same pain after surgery and still couldn't go on the cruise. We obtained a repeat MRI study, and the other surgeon had done a perfect laminectomy at L4-5. But the new scan showed a large tear in the annulus of the L5-S1 disc. The man and his surgeon took a chance on surgery that did not pay off. The main clue that the decision was wrong in the first place was the type of pain. Spinal stenosis causes claudication pain down the legs with walking, not a knife in the back pain that's worse when seated. This man had a bad result, but what did he do wrong? Well, he didn't get informed. It's your body. You must quarterback your own health care. Had this patient visited our site, learned the pattern of different types of back pain, he and his surgeon could have obtained a repeat MRI and discogram demonstrating the painful annular tear at L5-S1, leading to the correct treatment and a successful outcome. Stuff like this happens so often in spine surgery that doctors even have a code for it, post-laminectomy syndrome. Being your own quarterback means knowing the cause of your pain, appropriate imaging results, and when you need to act, finding the right doctor for an intervention. I know, that's a lot to remember. Well, here's a healthy hack. If you or someone you love needs spine surgery, complete this checklist first. If you can't check off all 4 of these boxes, then you are not ready for surgery.